Hi there, my name is Dr. Julie Toomoon. I'm a naturopathic medical doctor and an acupuncturist practicing in Plymouth, Michigan. And this is a little introduction to myself and my practice to give you a better idea of who I am and how I work. So to start off, my naturopathic medical degree is from the National College of Naturopathic Medicine, or the National College of Natural Medicine now, in Portland, Oregon. That is a 4-year graduate level medical school program. At the same time as I received my ND, I also participated in a Master's of Science of Oriental Medicine, and therefore comes my acupuncture training. My schooling in Oregon was 6 years, and after that I moved to Michigan to begin my practice, and that was 10 years ago this year, actually. So I'm excited to continue to work with my patients. I have kind of a different philosophy, I think, than a lot of naturopathic doctors. I tend to look at the body through the scope of Chinese medicine and then the scope of biotherapeutic drainage and Sanum therapy, which gives a different explanation, I really believe, for why and how our cells function the way that they do, how illnesses develop, and then what can really be done to cure them. I like to say, and I've given a lot of lectures on the topic, that I practice non-weaponized medicine. Generally, I'm not looking to kill anything in someone's body. I'm looking to harness the healing power of the body, to restore that balance and put the body back in charge of its own processes. I think that's missing from a lot of medicine. And as a result, patients really feel the impact of that, because a lot of doctors, and natural ones included, are more interested in kind of beating the body into submission than they are in figuring out what's really wrong, what level is that dysfunction at, why is the dysfunction occurring, what are the blocks, how do we remove them, and then going from there. I employ many different techniques, so each of my patients has a treatment plan designed specifically for what they came in for, how their body's functioning, and the issues that I could see on my extensive evaluation with them. And therefore, every treatment plan is different. No two people have the exact same process, because no two people are exactly the same. Starting treatment with me can usually be accomplished by beginning with a free 15-minute visit. I love the free 15-minute visit. It gives me a chance to get to know the patient. It gives them a chance to get to know me. It also allows me to understand where they've been and where they're at with the issues that are of most concern to them, what they're looking for as far as treatment, what has worked, what hasn't worked, and kind of what their hopes are as far as resolution or containment of the problem. It also gives the patient a chance to ask a lot of questions of me. How do I work? What are my thoughts on their condition? What experience have I had? And then we can come to an understanding before we begin treatment. It's my ideal way to begin. Not everybody does start that way. Some people know exactly what they're looking for and they just come right in and get started, but that is available to everyone. I can do that via the phone or in person, and can usually easily accommodate that into anyone's schedule. Now, beyond that, there's a number of different ways that we begin treatment. For some people with especially very complicated problems, I love to solve difficult problems, and I have a lot of experience with difficult health problems in my practice. Well, difficult cases need comprehensive evaluation. And so with difficult cases especially, I usually begin with my full intake. And that's a 2-hour process where we, using my bioenergetic assessment tool of a machine called Amora from Germany, I assess the body for food intolerances, food sensitivities, heavy metal toxicity, parasites, protozoans, chronic viruses, chronic bacteria, organ stress, and some elemental dysfunctions in terms of needed minerals and substances and such. Throughout that process, I also do some targeted physical exam evaluation. I do some urine evaluation in my clinic, and in certain cases, I'll also send patients off with a blood requisition to get some basic blood work, especially if I feel like it's needed to help identify which level of the body their problem resides on, and also if their cell membranes are functioning the way that they should be. So that process takes 2 hours. At the end of it, each patient leaves with a list of the foods that they can and cannot tolerate, also with the beginning treatment plan, indications of where their organ stress are, of course, if there's viruses, bacteria, and etc. that need to be dealt with. And we've had a chance to discuss all of that. Other patients begin just with a 1-hour visit. Some people just want their food sensitivity testing done. Some people just want to check out a few organs, see if there's stress, and then also to begin on maybe a plan for a very targeted problem that doesn't require all that other investigation. Other patients begin just with Chinese medicine, and Chinese medicine is one of my great passions and loves. I think Chinese medicine explains what goes on with the body better than any other medical modality out there. That perhaps is because it's been around for one of the longest spans of time of any medical modality, at least 5,000 years for Chinese medicine. Acupuncture dates back to the Stone Age, so it's been in practice a long time, and the philosophy behind it is sound. A lot of people have never experienced acupuncture, and they wonder, does it hurt? Is it difficult? And it shouldn't be. Acupuncture is a massively impressive healing method using identifiable pathways on the body that have completely different electrical signatures than all the tissue around them to create substantial change, not just locally, because a lot of people think of acupuncture just for pain, but also dramatically on the organ systems, on the nervous system, on the brain, on the digestive system. I've seen cases of chronic depression just significantly altered by acupuncture alone, just as an example that the impact is far from just being on pain, even though that's what it's most widely known for in the Western world. So an acupuncture visit is a 1-hour visit, and it involves taking a nice history, and we feel the pulses in Chinese medicine. The pulse has a dramatic sort of insight for us into the functioning of the body and the different organ systems and accumulations of toxins and such. And then we look at the tongue, which also has a fantastic map of the body on it and gives us indication how the body's functioning and which parts of the body are stressed. And then we apply treatment accordingly. And not all Chinese medicine visits involve needles. There's so many other great Chinese therapeutics, cupping, moxa, gua sha. So it just depends on the person and what's indicated. But the point is that everyone in my practice gets unique treatment. I'm a specialist in unique evaluation and treatment. I'm a constant researcher. There isn't a time that I'm not reading a book on a topic of medicine. I'm involved in researching and expanding my base of knowledge at all times in a lot of different therapeutics. And it excites me to get to find new and better ways to help patients faster. So if you're looking for a physician, I would say, who is going to take the time to understand what's going on with you, to take the time to explain what their thoughts are as far as why you don't feel well, and then who's going to create a custom crafted plan that is directed at your needs, your circumstances, and your body, then that's what I specialize in. It was nice to talk to you, and I hope this helps get a better idea of what my practice is all about. If you have more questions, definitely visit my website, www.7directionsmedicine.com. You can email me at drtwomoon@7directionsmedicine.com, and you can always call my office at 734-414-7669. Take care.